when we're talking about mental health and veterinary medicine, I think we have the good aspects of it, and then we have the not so great aspects of it.
Yeah.
I think for those of us who are in the profession, we see more of the not so great aspects of it. Unfortunately, and I would say since COVID, things have gotten a lot more prominent, more difficult, but we are pretty high on the list for suicide rates among among medical professionals.
Really?
We've been climbing. We've had in the last several years a suicide crisis. We've had some pretty top people in our field commit suicide. And so it's something that is kind of in the background of, it's a very emotionally charged field, very mentally difficult field.
Yeah.
And most of us that go into it are, we do it because we love animals.
All right, Dale.
David.
We are back. And as you can tell,
Whoa!
video recording today.
Did you ever see that movie Pleasantville?
No.
Yes.
Jen Singer.
Yes.
Welcome, Jen.
Yes, thank you.
So we just came out of black and white because we were on audio for a while, and now we're back in color and video.
I see.
Yeah,
okay.
Full Technicolor.
Yeah.
All right.
I need to watch Pleasantville. I'm lost in the sauce here. So it's two therapists and a veterinarian today.
Behind a bar.
Behind the bar. So that was the original inspo for the bar, that little countertop.
Yeah.
And this is going to be an exciting conversation.
Yeah.
But I just want to say that the impetus of that was, unfortunately, Dale, you informed me, at least, I think it was about a week ago, that your dog of 14 years passed away.
So June 5th, Jake, so he's 14 and a half. We unfortunately had to make the decision to put Jake down. And, man, this is going to be, already I'm getting teary-eyed here, but he was a great dog. And it dawned on me at that moment, albeit even a little bit last minute, so thank you, Jen, but it dawned on me that it's like, man, this dog, so Jake was actually trained as a therapy dog as well. He worked with me when I worked for the University of Tennessee in Chattanooga. And when I came here to the Valley, our first year back in the Valley, he was with me, working with a lot of people. And eventually he retired, but he was a stay-at-home dog. And just a fantastic animal. My wife and I would call him our first child. And I can't believe I didn't think earlier to have the conversation with a veterinarian, but in some ways it's like all too, like, I would say appropriate now, in the sense that he was so meaningful to so many people and to myself, and it now begs the question, okay, like, this is one area we haven't discussed yet.
True.
And I think for me, coming from the veterinary side, mental health and the veterinary field are very closely intertwined, so much so that most people don't realize it. And for a lot of people, pets are their children. They are part of the family. And so, everything that affects us can affect them, and vice versa. Like, everything that's going on with them affects us and our mental health. So it's definitely something worth, kind of talking about and just opening up. What does that really mean, for the pets and for us as individuals, or the owners?
I think, sorry to interrupt here, but Jen, do you mind sharing with us a little bit, like, so like, who you are,
am
where
I?
you're from? Who you are, where you're from? Like,
so I'm originally from Florida.
Okay.
I moved up to the Valley 18 years ago. So I studied, and I've been a veterinarian for 19 years now. And I studied in Louisiana. So LSU is where I actually did my veterinary schooling.
Haven't been to Louisiana. But
so I went there and I did my 4 years of, vet school. And then I did 1 year of an internship. It was a medical surgical internship in Florida. Originally, I thought I wanted to specialize. So just like the human side, you know, we have specialty fields like cardiology, dermatology, surgery, all those different fields. Originally, I wanted to specialize, and then I got to a point where I wanted balance in my life. You know, so much of that required additional education, additional time, and just I could see how a lot of people were a little bit burnout, you know, by continuing. And for me, I just realized I want a balance. You know, I want to be able to be in my job, love my job, and have a balance with my job. So I went into general practice. So I've been in general practice for 18 years now.
Okay.
So
yeah.
And I was at one practice for about that 18 years. And for the past 4 or 5 months, I've been doing relief work. So I actually go into clinics when they are lacking doctors, and I fill in and help them out. And so I have several different clinics that I'll bounce around and work in.
Okay.
Yeah.
Wow. Okay. And I think maybe the most important question, are you a cat person or a dog person?
Ooh, hot take.
I'm not supposed to tell my clients it. No, I'm a dog person, actually. I'm a dog person.
Okay, you're welcome here.
We can continue.
Yeah, you're welcome here.
Yeah. I had a cat. I had her for 17 years. Yep. But I'm more of a dog person. So yeah.
And I know you own a dog now.
I do. Well. I have a dog. He's about to turn 5. His name is Stanley.
What kind of dog is he?
He's a mixed breed. So I rescued him. He was, we see a lot of rescues from Texas. And so he was a rescue from Texas.
That's so funny because I was literally like, my wife and I were just carousing Pet Finder. Like,
that's where I got him off of. Yeah.
Okay. Yeah. And I noticed like a lot of Texas. Yeah. A lot of like Texas.
I would say majority of our rescue dogs come from Texas.
Wow.
And
Why is that?
You know, there's just a lot of need for overpopulation there, I think.
Wow.
And just programs to where they're not able to care for a lot of them. So they bring them over, and through Pet Finders where I actually found my little guy. And I drove to Maryland to pick him up. So
they like shipped them?
They shipped them over.
Okay.
Yeah.
Wow.
So he's a little Texas guy, but he's pretty awesome.
Yeah. How many dogs have you owned throughout the course of your life?
Several when I was growing up, but my own personal dogs, I've had 2. My first one, Daisy, she lived until she was 15.
Oh, yeah.
And then I had my cat, and she lived till 17, and now I have Stanley.
Yeah.
Wow. So I'm the atypical veterinarian. I keep like one pet at a time.
Right.
So I can focus on that one pet. I work long hours.
Yeah.
A lot of veterinarians, you know, have a lot of different, you know, pets, rescues, things like that. But for me, I'm a one person.
Yeah, I once knew of a person who complained. His wife was a vet, and he complained that they would adopt so many dogs and
I think you can tip over a point to where you do have probably too many because you're not able to give them all the care you know that they need. So
so you've been through the process of a pet passing.
I have.
And just on the subject of
so
dogs dying.
The pets that I grew up with. So my parents had, you know, they just had a dog pass away a couple years ago, and unfortunately, I've played I'm not only their family member, but I'm also their doctor, you know? So for me, it was a very difficult situation because I was the one to euthanize each of them.
Wow.
Yep. So there's a whole added layer of this is, for some people, one of the hardest things they ever have to do, you know, to make that decision. And unfortunately, I think majority of the time you end up making that decision for them. Most of the time, they're not going to pass on their own. And it can be devastating, you know, for people, especially when that is the only thing that they have. You know, I've had clients who that's their life. Their pet is their life. So I've had to be kind of that doctor and that grieving parent and all of the above. And it's very difficult. Very, very difficult.
You mentioned at the beginning, before I interrupted you, about how intertwined mental health and veterinary medicine is. And I'm wondering if you can share a little bit on that, specifically what you mean.
Yeah. I think when we're talking about mental health and veterinary medicine, I think we have the good aspects of it, and then we have the not so great aspects of it.
Yeah.
I think for those of us who are in the profession, we see more of the not so great aspects of it. Unfortunately, and I would say since COVID, things have gotten a lot more prominent, more difficult, but we are pretty high on the list for suicide rates among among medical professionals.
Really?
We've been climbing. We've had in the last several years a suicide crisis. We've had some pretty top people in our field commit suicide. And so it's something that is kind of in the background of, it's a very emotionally charged field, very mentally difficult field.
Yeah.
And most of us that go into it are, we do it because we love animals. There's this compassion that, unfortunately, if you've ever heard of medical professionals talk about compassion fatigue, it's a real thing. It's a real thing.
Yeah.
So, those of us who are in the profession, we see kind of this other side of it. Our goal, our job is to make pets feel better, ultimately their owners feel better, and kind of help that good part of the mental health, where pets are, I don't know, sometimes the only thing that they have. Animals are just, they love you unconditionally, most of the time. And so they are just this comfort, this joy. Our job is to keep them happy and healthy so the whole family can be happy and healthy. But that does take a toll on the mental health of those in the profession, for sure. And, I've experienced ups and downs in my profession to where there's sometimes I'm like, I can walk away from this and never come back to it. I'm done. I'm done.
Like you've considered.
I have. I have considered walking away from it. I've been at the point of compassion fatigue. I've been at the point of burnout. I've been at all kind of the levels of it. The reason we stay in it is because we truly love what we do. We truly love animals. But it's difficult. It's difficult sometimes. You're expected to perform miracles and you can't. A lot of times you help families through a grieving process, and we're trained to be medical professionals. We're not trained as therapists. So there are times I'm like, I have no idea really how to make this better. So it can be very difficult, especially as a general practitioner. I have had pets I've seen from a puppy all the way to their end. And, it's as hard for us sometimes to kind of go through that process with the owner.
Remember when they first came in.
Yeah, you remember them. I have certain ones that stand out in my memory, and we've been in the room just crying with the owners, because that's been a part of our career, our lives. Some people can become like family to you as well. So there's a huge kind of area of veterinary medicine where mental health is something that, I'll be honest, I don't think they taught very well in vet school. We didn't get a huge kind of exposure to it on how do we manage this through our careers.
You mean for yourselves and
for
then
ourselves,
for your clients?
For ourselves, for our clients. And a lot of it is just learning on the job, how to manage it and still help out, the patients, the owners, and do it in a way that is professional. And that doesn't, cause your mental health to be damaged.
Well, and that has to be really hard, because I would wager in some degree, I don't know the statistics here, this is a strict guess, but in some degree I would wager that you see a lot more death than, say, a doctor for people. If they're in general practice, that is. Because typically it's like, okay, if somebody's, let's say, going to pass away, they're going to go to the hospital or something of that nature. They're going to go, and they may see a different care provider at that point, but their GP may not necessarily see them. They may hear of it, right? But in your situation, it's like, no, it's still, it seems that in veterinary medicine, it hasn't, you don't necessarily have the conglomerate hospitals like to where you have a physician that you may see one time and you may never see them again, or you may only see them for specific things. But in veterinary medicine, you're it.
We're kind of everything. We do have referral facilities, but not everyone can go to a referral facility. So, I'm their general practitioner, I'm their cardiologist, I'm their surgeon, I'm kind of everything. And it's hard to be everything, to everyone all the time and, feel like you're doing a great job with it. I would say we do see a lot more kind of euthanasia, a lot more death. We have to talk through a lot more guarded prognosis, cancer, different things like that, and help the owners make the decision to be comfortable with that euthanasia and then help them through it. And unfortunately, I've kind of looked back over the course of my career, and I'm already in the thousands, as far as euthanasias. And so over time, you have to learn to, how do I, in a sense, compartmentalize this so I can continue to do my job? Yeah. But also, the one thing that, like I said, we didn't get a lot of exposure in vet school. The one thing I wish for our profession is that we had been encouraged to seek counseling and therapy sooner. Yeah. I think that would help us to learn how to, once we've compartmentalized, how do we bring that back out and deal with it in a healthy way so that, it doesn't continue to manifest in unhealthy ways. Yeah. So
how many euthanizations are you doing in a week? On average,
less, thankfully less now than I used to, since I'm more relief vet.
Gotcha.
It would differ. I would have a month where I wouldn't do any. I've had weeks where I've done 5. Okay. I've had some where I've done 3 in a day. It kind of comes and goes.
Got you.
Yeah, I think the hard part for me is that I would have an appointment where, you have a euthanasia. The next appointment, you have a first puppy visit, and it's like that transition between switching into, okay, now we're happy, we're excited again, changing gears. So it's taken a lifetime of a career to learn how to manage that. And for me, really only the last 2 years have I been in counseling and sought counseling. So it's something that I think we know about in our career and in our field, but I don't think we seek enough help.
Well, and unfortunately, I would say within our field too, there's a very wide spread of the type of therapy you can get, of the different practice that you're going to approach, the different modalities that you can seek, and that can become a hard thing to understand. Okay, what's going to suit me best? What's going to help me best? But I'd say as a therapist, like as far as compassion fatigue, I can resonate and relate to that a lot, because I would say that in many ways we see something similar, not in the sense of, okay, someone passing necessarily, but you have somebody who's in deep crisis and then somebody who's perhaps like, yes, they're still having a hard time, but it's not qualitatively the same experience. And so what we're walking with is very different.
Very different, yeah.
And so you're constantly changing gears and trying to make sure that you stay at a place that is not noticeable to your client. Like, because you can't just spill the beans. Oh, like, this is, well, you have no idea what I just saw.
Right. Exactly. Yeah. You can't be disclosing.
And to not take it home with you, to filter it out. I've had days where I've gone in and clients who know me better, they're like, you're having a rough day. And I'm like, oh, sorry, I didn't realize it was showing on my face, kind of just the stress of the job. But, for me, it's become a lot more personal with mental health in the last couple of years, of just, am I working to be healthy with how I'm dealing with the stress and pressures and the things that other people are going through? Because I have a personality that I take them on. I think a lot of veterinarians have the personality that we take on the pain of our patients, the pain of our clients, those cases that we're like, we don't know what to do with, that keep us up at night. And how do we separate that so our mental health stays in an area where we can still be effective and love our job and be able to help more, not become so overwhelmed with it or skeptical. Or, jaded or, just calloused. Yeah. I think
that would be, it seems like that would be really hard not to occur, like in the sense like to where there would be a level of, you said compassion fatigue, but also it just desensitized. Because in some ways you would have to.
You have to.
Like you have to a certain degree. It's like, it seems like that delicate balance of, okay, how do I bottle but not become a bottle factory? Right.
Yep. And that takes experience and learning of times when you're like, okay, I'm not doing this well. the compartmentalization to where we do in a sense become desensitized because I put it in that compartment and say, okay,
Sure.
I'm going to get through this really tough euthanasia.
Yeah.
I need to separate myself from the emotion of it,
Yeah.
but be compassionate
Yeah.
and kind of find that balance.
Yeah.
And I think a lot of that depends on where you're at in your career, where you're at in your personal life,
Sure.
how many things kind of filter in to what that day looks like for you.
Yeah. You mentioned behind the scenes a little bit earlier when we were talking, you mentioned that you've seen since COVID anxiety in pets.
Yes.
That completely just hit me left field. That was the last thing I expected to hear.
Yeah. We've always had some pets that are just more prone to anxiety. Certain breeds are more prone to anxiety.
Okay, which ones?
I mean, border collies. Come on, they are neurotic. They're neurotic.
If they're not running.
They're neurotic. More of like your herding breeds that need jobs, and we're not giving them the mental stimulation that they need. We can set them up for. Well, now they have anxiety because they're not able to get out. Things that make them who they are. And that need for exercise.
Yeah.
Right.
But since COVID happened, what we've seen, and kind of initially when it first happened, most veterinary offices shut their doors in the sense that we still operated, but we're not allowed to let people inside.
Yeah.
And so the first thing I noticed is separating the pet from their owner created a lot of anxiety. One for the owner, because they're out there in the car not knowing what's going on.
Yeah.
And the pet because they're separated from their owner.
What in the world?
Yeah. So that's kind of the first thing we started noticing. But
I didn't even think about that.
Yeah.
Yeah.
Okay.
So you would have to deal with more agitated.
Yeah.
pets coming in.
And agitated owners because, they're worried about what's happening, and you can't blame them for that. We try to be as professional as we can be like, look, this is what's happening behind the scenes. I know you can't see it. And because we were such a small kind of town clinic, most of our clients knew us and like, we trust you, we trust that, what's happening. So we separate them from the people they know and the pets are anxious. But what happened is people became anxious during COVID. And so they adopted a lot of pets. Pets. And so because they could not go out in public, these pets are now at home with them, serving a good purpose, being companion for them. But unfortunately, especially a lot of the puppies did not get proper socialization during that time.
Oh.
So now they start coming back into the clinic and they're full of anxiety. They haven't had kind of the socialization with people, with other pets, being away from their owner, kind of that separation. And so I would say the anxiety for pets climbed during COVID.
That's wild.
Because we weren't seeing socialization. We weren't seeing kind of the normal training processes.
Wow.
And because I think I think pets are a great tool, for companionship, for lowering stress levels. I think they're fantastic. But I think if we depend on them too much, now we are transferring our anxiety to them.
Yeah.
And they don't learn normal separation from their owner.
Yeah.
And then unfortunately, once COVID kind of starts, getting a little bit more into what is the new normal for us, a lot of those pets ended up being put back in the shelters because people went back to work. People went back to their jobs. They didn't have time for them.
So now you have a pet that's just a wreck.
Yeah. So we would see a lot of shelter returns, a lot of just anxiety. And I've dispensed more anxiety medication for pets since COVID than ever before.
Wow.
Because ultimately, if we allow them to come in and continue to be a mess every time they come to the clinic, their anxiety ramps up more each time.
Yeah.
It's a negative association each time they come. So our job is to make that process as good as we can, which majority of the time now, medication is our way that we can help do that, bring down the anxiety and try to still modify their behavior and teach them these things aren't scary. They aren't bad, but we can only do so much, to do that.
Can I ask, what's the number one medication that's dispensed for anxiety in pets?
So I'd say the top three would be Prozac, So we do Prozac. Yep.
Wow.
Yeah. So that's kind of like your long term.
Crazy.
You need something on board all the time.
Yeah.
We have more situational medications like gabapentin and trazodone as a combo.
My goodness.
That's so
Yep.
wild.
My goodness.
And those are like situational.
It's literally like people.
It is. Yep. It is. And you know, for me, I don't want to dispense drugs if I don't have
Sure.
to. You know, we
Yeah.
want them to be happy, healthy, you know, great socialization. But if it's they're ramping up and now I have a dog who is afraid to come in, and also probably the number one reaction of fear with animals is biting.
Yeah.
You know, so I have staff members that you're keeping safe, owners that you're trying to help them regulate their dog's anxiety, and medication is usually, unfortunately, in the mix, at least until we do some behavior therapy that we can eventually maybe get off some of the medications.
Yeah.
Mm-hmm.
Yeah.
So,
have you ever had some like wild situations with like out of control?
Yeah, I mean,
like
we've had, so, you know, I've had some dogs that will actually lunge. They will lunge at you. I've had some knock me down, you know. I've been bitten in the face by dogs. Yeah.
Wow.
I've had unfortunate situations where we've had dogs that have had to be euthanized because of their behavior, because they become a danger.
Yeah.
And those are devastating circumstances when that happens. So,
like because of the behavior at the vet?
No, not usually. It's behavior at home.
Like they bit someone.
They've bitten a child.
They've
They've bitten, or worst case, they're not up to date on their rabies vaccine. And sometimes, you know, we are put in a situation where we are having to make that decision.
Yeah. That's hard.
Mm-hmm.
That is fascinating. I didn't imagine that there would be so much overlap. Like, as far as the medication specific. Well, I guess I knew like, okay, you have doggy aspirin, but like, as far as the
anti-anxiety,
the anxiolytics and that's fascinating. Okay, so what about antidepressants? Do dogs get on antidepressants?
Yeah, we use antidepressants as well. And I believe trazodone was initially an antidepressant, but it made people too sleepy. And so we kind of transitioned it. So there are different antidepressants. I usually try to stay away from a lot of those. I try to use the least amount of medication that gets the results that we want. And most of the time with Prozac, gabapentin, or trazodone, along with behavioral therapy training, we can kind of get the results we need.
Do you feel like people will oftentimes get the behavioral training that's necessary, or do they oftentimes rely on the medication?
Probably rely on the medication because it's the easiest first thing. It's something they can feel like they're helping, and they are. The problem is we don't have a lot of behaviorists around. We don't have a lot of ability to send them. Closest behaviorist is, I think, in Leesburg or Fairfax area.
Wow.
So we don't have the capability to do enough of the training that we need to do.
Wow.
Even with, let's say, like obedience training, some of them can handle just going to obedience training, but some of them need more. And so unfortunately, I would say most of the dogs that need behavior training don't end up getting it.
So when you say behaviorists, you're not just talking about obedience, like a trainer.
No,
like
they're specific.
Trainer.
They are trained, specialized. They're trained in behaviors. They're trained in working with the medications. They're trained in kind of just what does this behavior really look like underneath the surface? I mean, because even for people, fear, anger, there's always something underneath that, you know, that usually needs to be addressed. So we're trying to figure out what are their triggers? What do we need to kind of address at home with their routines to figure out, okay, how can we modify these behaviors?
Do you see that some, like, and I don't mean to oversimplify, but do you see that sometimes like it's simply related to the fact that the dog doesn't get enough exercise?
I think certain breeds, yes.
Like,
I think certain breeds, they need to.
Very silly, but
and it's not, I think it's not just kind of the exercise. I think some dogs need mental stimulation. I mean, there's certain dogs that need problem solving, you know, different things that we can do just to engage them. I think exercise is a huge part. But I also think that companionship and the time we spend with them also makes a huge difference. I mean, if we're working, you know, 12, 14 hours a day, they're not getting kind of some of that quality time that they need too. And I know sometimes we domesticate them, we, treat them like humans, but I think from what I've seen is that if we don't address some of those things and recognize they need companionship too, that we're kind of missing the mark, and that's why we're seeing some of these behaviors.
Yeah, that's interesting and I think that makes a lot of sense though too, because effectively what you're saying is like, okay, they need mental stimulation, they need exercise, but they need to feel like they're doing something.
Yeah, some of them do. Certain breeds do. Now, I have certain breeds that, they are very happy to sleep 23 hours a day.
What breed is that? Is that like a bulldog? I don't know. I'm completely guessing.
Yeah, and your older dogs.
Sure.
Your older dogs. I mean, they transition into a different phase of life, But yeah, just, some of these breeds that are very happy, like your Yorkies, your Poodles, yes, they need some stimulation, but they're just as happy sitting on their owner's lap all day long because they love, that connection. They love that.
That's just what they want to do.
Versus if you have like a working breed dog, they need that stimulation. Your healers, your border collies. A lot of their behavior issues come from they're not getting enough stimulation.
That's so funny. So obviously, in addition to Jake, we have Darla. She was Australian Shepherd. She's still alive. Like, one of the concerns for my wife and I was like, she's gonna get depressed. And about a year ago, we got some cats, and she actually, they're outdoor cats, but she got very close to the cat.
Yep.
And she,
I didn't know that.
Yeah, the cats will sleep with her.
Yeah.
What?
And so we feel like that's actually helped her a lot. Like, because we went outside, and she's an outdoor dog now.
Yeah.
Like, she doesn't even like to come inside. We've tried to like have her come inside, but she doesn't want to. She doesn't want to, yeah. She wants to be outside. Like, and most relevantly,
what's the story with that?
With that being outside?
Yeah, why does she not want to come in?
So there's certain days, like if it gets extremely hot, like no, Darla, you have to come inside.
Right. Yeah.
But like, especially in the middle of winter, that dog will sit outside in a curled up ball in the middle of the snow and be completely happy. You cannot get her inside.
Yeah.
Like, she lives for it. And it's the most fascinating, like, wonderful thing. Like, in some ways, I'm just like, wow, like, you're amazing.
Yep. My dog loves to just go sit out in the sun. And there are times I'm like, it's like almost 100 degrees. You need to come back inside now, know. So they like the outdoor stimulation. I mean, we domesticate them, but they're still animals, underneath it all, they're still animals. So, we need to kind of provide an environment that's enriching for them too, versus just we've made them a pet, they're inside, we can keep them inside and kind of, pick them up when we want to play with them and then just kind of put them off to the side. No, they still need, and it's our job as owners, our responsibility to make sure that, we're using them for companionship, but are we providing the same to them? Are we providing an enriching environment to them as well?
Yeah, that is so fascinating. But I was gonna say too, it's like in conjunction with that, like with the depressive piece, we noticed, we were concerned with Darla, but it seems like the cat, like having another animal there has really helped maybe soften that blow a little bit. But the reason why I brought her up in the first place was that, like, I have never seen her more happy. There was one time I took her, this was like, this was 12 years ago. So she must have been 2 at the time. And I took her to a farm that I was volunteering at, and they had goats. And I was like, all right, Darla, I'll see what you can do. Like, literally, she herded them so quickly.
Yep.
Like, I'd never seen anything like it. I didn't teach her how to do that. It's literally
instinctual,
Oh yeah, it was so impressive. She literally had them in a ball like that. Like, just so tight. And I was like, okay, maybe I should try to get her to move them this way.
Right.
And she did.
Yeah.
Like, I was like, okay, Darla, let's go. And she came this way, and she made them go that way too. And there was a really big goat, like he was a big male, and he tried to go down and like headbutt her. She literally like bit and barked him right in the face.
She's like, I'm in control here.
Oh no, she didn't even miss a beat. Like, it wasn't like, hey, I'm going to try this on for size. It was like, oh, this is what I do.
Right.
Like, it was fascinating.
Their drive can be so strong, and it's instinctual for a lot of them. But I have had pets that have experienced grief and depression after they've lost a housemate, whether it be, their owner or another pet in the house.
Wow.
And, just like you guys probably see, I have to tell, the owners, there's no timetable for grief. I mean, it can be 3 weeks, it can be 3 months.
Yeah.
We just help them through it. We pay more attention to them. We walk them, we love them, and kind of help them through that time period.
Yeah.
The answer is not usually always we get them another kind of companion, because sometimes they're not quite ready for it, can work out negatively.
Yeah.
But they do experience grief like we do.
Yeah. That is so fascinating. That's very interesting. It's one of those things that I can say that I definitely didn't think enough about. And it definitely begs a lot of questions, more questions. So I'm curious, like, what do you see so this brings up, like, you were talking about behaviorists earlier, and now, are there two? I feel like I used to hear that there was like two different schools of thought on how to train animals, like whether it was like a style akin to something like Caesar Milan, or more directed towards some other type of training. I'm not familiar with this, but what are your thoughts on that? Like, are there different types of behavior training?
I think there's a lot of different types of behavior training, or let's just say obedience training.
Okay,
I think there's a lot of different types of obedience training. And then as far as behaviorists, they're going to work specifically with that pet and kind of figure out what works best for you.
Okay.
It would be very similar to probably you guys working with kids and saying each kid is different in how we kind of approach this.
Yeah.
So I'd say there's a lot of different types of obedience training. I think we do a disservice when we try to put an animal into a specific type of training and we don't recognize that this is not working. This is not what speaks to that particular pet.
Yeah.
And I'll say for my dog, Stanley, he is a super sensitive little guy, so he gets his feelings hurt very easily. So if I were to put him in a more direct style type of training, he'd roll over and be like, I'm done. I can't do this, So I think we need to be aware of kind of their way of learning, their way of responding. Some pets respond better to a firm voice. Some respond better to little like clickers, little just different things. I think we have to recognize how did they learn best?
Yeah.
And then that's where training will actually, I think, be more beneficial for them.
And that takes a lot of work.
It does, which pets take a lot of work. For me, they are part of the family. They are, and I think our responsibility just as veterinarians, as humans is, we care for those that are in our care, and we were made to care for animals. And I think the way that we do it matters. I think that we need to make sure that we are taking care of them in a way that helps them thrive and be happy and healthy. Yeah. And then ultimately, we're going to be happier and healthier, if they are happy too.
That was one of the hardest things I think about Jake's situation, was that like his quality of life had deteriorated so much that he was incontinent. So we didn't have him sleeping in the house.
Yep.
And at that point it's like he couldn't really chase the ball anymore, which is what he lived for.
Yeah.
He would have tried to do it the last day he was alive.
Yep.
He wouldn't have been able to. And then it's like you're like,
and that's when we start having those quality of life discussions. I mean, they are specifically quality of life discussions as far as when I, have those discussions, it's are you having more good days and bad days?
Sure.
What is that one thing that they love to do? Whether it's they're going to show up at that food bowl or they're going to chase that ball. Are we still doing those things?
Yeah.
We have the ability in veterinary medicine to relieve pain and suffering. Sure. We do it through euthanasia. I think there are cases where, we have to just find that line of when is it time? We don't want to do something prematurely. And on the flip side of it, we don't want to do it too late, because I've seen the devastation, when people realize I should have done that much earlier. It's it's a constant line of where's the patient at, because ultimately, that is my first responsibility. I'm an advocate for pets. But also, where are the owners at? How do we make this the best transition we can for everybody involved? So it's a peaceful passing. They're not in regret, whether it's too early or too late.
Yeah. I found, so this, I guess, is where like therapy intersects, especially with couples, where I've heard of situations where a pet requires a really expensive procedure, or they euthanize, right? And maybe one spouse is obviously like, I'll pay whatever for this procedure, and the other spouse is like, it's just it's a dog. Like, right. We're connected to the pet, but I'm not going to pay $5,000 for a procedure. Like, I'm guessing you run into situations like that.
I've had that situation a lot.
Yeah.
I've had, unfortunately, there's been arguments, over it. Yeah. And ultimately, at the end, a lot of times I step in and I say, we're going to have to get on the same page with this. Ultimately, my job is to advocate for the pet. And this is where we're at. This is what we need. We try to help financially if we can. We try to, especially if it's something that this pet can live a happy, normal life. It's just something that's going to save their life. We're going to try to do everything we can to get that procedure done. If there's no guarantee. There's no, I can make them 100% better. Those are the difficult conversations because one's all in, one's not. Yeah. And that's where I need the therapist training to be like, how do I manage, the situation? Because ultimately at the end of the day, I have to make sure that pet's okay. And so I have to separate them from that and say, we've got to work this out and get on the same page. And there are situations where we've been able to do that and situations where we haven't, and we make decisions and walk away and not everybody's happy or comfortable.
Right. Yeah. Sometimes one person will be not as happy.
And then we go home as veterinarians and try not to beat ourselves up with all the different aspects that you're having to deal with and, and just try to separate
take responsibility for that. It's
How often do you run into people that you would describe having too many pets?
Often enough.
Okay.
Often enough.
Yeah, so I know in my professional opinion, it's like, okay, we see some of those types of what we would call disorders among pets and among other things, right? I'm wondering for you and your profession, okay, when you run into the scenarios like that, how do you approach that? What do you do?
Yeah, so I guess it kind of really depends on where we're at in that scenario. There are certain situations where I have owners who want to get another pet, and I'm going to strongly advise against it because I was like, we're at the quota, especially with cats.
15's enough.
With cats, the more you get, the more behavioral problems we can have, inappropriate urination, things like that. Yeah. The more on dogs, especially if you have quite a number of female dogs together, the more fights we're going to have. So there is kind of a tipping point.
Really? Okay, yeah.
Female, if they're not spayed?
Even sometimes if they are spayed. So pets can be temperamental, and it, sometimes depends on what the situation at home is too. They feed off of our energy as well. Yeah. So there are sometimes I just counsel against, I don't think this is the right decision. Yeah. Other times it's that you have too many, and unfortunately we're not able to give each one the care that they need. Yeah. And so not that I won't work as hard as I can to help each pet, but sometimes we're doing substandard medicine. Because we just don't have the financial ability to do that.
Why do you think they're like wanting more pets?
That's your job to figure out as therapists.
Right.
I think,
from your perspective.
I think it's different things. I think that certain things in our lives that cause fear, loneliness, depression. Yeah. Most animals have unconditional love. And so when we don't feel like we're getting that from the people that we need to in our lives, or, you look at the world and things are declining in the world very rapidly. I truly believe that. And I don't think that we have a lot of healthy relationships at times. And so we put that on pets because they're going to love us. It's almost that affirmation of we're being loved. And so sometimes it's just the numbers climb. We certainly have people who have probably some underlying mental health that get in hoarding situations where they just have way too many pets. And the care, causes the pets to not be healthy.
Yeah.
You mentioned unconditional love. Why do you think that is? Like, and I'm wondering, do you actually think, and I'm playing devil's advocate here, knowingly, knowing I had an animal that I feel loved me unconditionally.
Yes.
Like
I won't say that every pet has unconditional love, and certainly not some of the
cats.
Cats. No, there are cats who are so loving, so attached. I think my cat was very attached to me, but once again, she was the only pet in the house at that time. She did grow up with my dog. Like, they were 2 years apart from each other, so they grew up together and lived together. But, when I was gone for the day, I could hear her before I came in the door, screaming her head off, you're home, and coming to greet me at the door. So I think she had her own sense of love for me. Sure. I think we see it more so in dogs, certainly that kind of unconditional love that, just, you're so happy for my dog. Doesn't matter if I'm gone 5 minutes or 5 hours, he greets me the same way and just so excited that you're there and you're home. They want to please. That's their nature, and I can't help but think that, God made them that way in some ways, just to have that, I want to please you. He created us to have, in a sense, dominion over pets, and we're responsibility to take care of them. But I believe he co-created us to be able to exist together and, get enjoyment from each other.
There's a funny allegorical story about when God created dogs and cats in the Garden of Eden, and basically it of course the story isn't meant to follow their creation guideline, but I just thought it was really funny in the sense that it talks about how one day an angel comes to God and it's Lord, it seems like man is kind of lonely, and so God says, well, let me create an animal in my image, in my likeness, but that shows them my direct unconditional love. So God created dog. Right. And then after a time, an angel goes and sees man and dog, and then comes back to God and says, it looks like they're kind of taking dog for granted. Yeah. And they don't really appreciate everything that's there. And so God says, let me create an animal that shows them just how little they are.
Oh, yes. How far they fall down the line. It's a cat.
God created cat.
Yep.
And how the story is read is that, and man was happy, dog was happy, God was happy, and cat didn't give a shit.
He didn't care.
And I can't help but feel like in so many instances that's true. However, as I say this, I also would be remiss if I didn't also say, my daughter has a cat that I've never seen a cat lick someone's face before. This cat loves her. Will lick her face like a dog. It's very interesting, and it is absolutely attached to her. 100%. Sleeps on her bed, has nothing to do with anyone else. Doesn't care about me.
Oh, no.
It wants her.
Yeah. No, my cat would be on my lap. She just had her ways of saying, this is how I love you, know. Cats do their own thing. They have their own rules. As long as we play by those rules, we're allowed to live in the house with them, know. But dogs definitely, it's as long as they are healthy, and don't have kind of that anxiety that we're not addressing, or the level of love that they need, I think, they can give unconditional love.
My dog Zuri, she's a mini golden doodle.
Fantastic.
And she loves everybody. She doesn't discriminate. She loves every species. She's just And so one of the things that my wife will criticize me about is that I will love on this dog.
Yes. Oh yeah.
Cuddle the dog.
Oh yeah.
She's which I've never seen this side of you.
You're painting yourself in a corner.
Yeah. And then I'm oof, and then I realize she's you cuddle the dog more than you do me sometimes. And it's, I've had to think think about it sometimes. And it is that part of, dogs, because dogs don't have that ability to, I guess, respond or they don't have so many conditions, right? In that way, where it's just like, yeah, that you cuddle the dog will respond to your cuddling, right? And so I think in many ways it's a less vulnerable way to get that affection, right? Because you don't have to be as vulnerable, because you don't have to, because the whole idea of vulnerability is the possibility that you might be rejected or it might not come back to you. But it's so much more predictable with a dog.
Yes.
Like, I know what I'm getting with my dog. Versus with a human being, it's like, hey, you might come, I might come with hugs, and my wife will be like, hey, today is not the day. Right?
Although I tell you, I'm not going to cuddle with a anxious German Shepherd when they're coming into the clinic, because you are not guaranteed that that dog is going to cuddle back.
No reciprocation.
So, certain dogs, you need to kind of be aware of their signals to you and like, no, I don't want that right now. But I cuddle with my dog all the time. My therapist even said, hey, you're having a rough time, go home, hug your dog, take him for a walk, you know.
1,000%.
Yeah.
It's interesting, and I'm gonna kind of display something that I in some ways I have mixed feelings about this, but in other ways I was like, no, it kind of seemed like a God thing. Like, but a couple days ago, my family and we were at the Greenway, and my wife and I had thought about getting another dog or a puppy, and we're like, you know what, we need to wait a little bit. Like, I don't want to go searching. If something falls on our lap, okay, so be it. But then, like, we go to the Greenway, and there was this lady that came out with a puppy of her vehicle, and I was like, man, I'm going to ask her where she got that puppy, like, because my daughter was like, oh, that's a cute dog. And like, so I went over and I just talked to her for a second, and then my daughters come out of the car and they start petting this dog, and they're like in love with this dog. And this lady's like, oh, well, we got her from a breeder down in Dayton, and I could ask, maybe she'll have other breeds at some point. I was like, yeah, let me know if you find anything out. So, I completely forgot about the conversation. We get in the car, we go home. She texts me an hour later and says, this lady just had a litter and she has one little boy left. And I was like, oh man. Like, so we look at the picture of this dog, and then my wife and I were like, oh, well, okay. Now, the odd part about this is I'm not a small dog person. I don't like small dogs, historically speaking. This was a bug. Of course, you know, like,
they make all different like combinations now.
Like Boston Terrier
with
a pug.
Bug.
That's not me. I'm not that person.
I remember you guys said you wanted like a Rottweiler.
Yeah, well, because I grew up with Rotties. Like I love, like as a kid, like I loved Rotties. Like they were always so protective. Like they were super, like with us as kids, they were great. Like she was like a nanny, like our Rottie. She was awesome. And I wanted my kids to have that same experience. But then again, it's like, when we do get one, I'd like a female, and I don't want to do that to Darla now. Like, I felt like, and maybe I'm wrong here, you can tell me better. Like, I felt like if we did get another dog, I wanted a little male as opposed to a female. Like, I don't know if that was the right call or not.
But I don't know. I'll say this. I do believe God put Stanley in my life. I do believe there's certain situations where he brings them at the right time. I had females pretty much exclusively, so he's my first male dog I've had. And I waited a little while after my cat passed away before I got him, just because I needed to be ready, to give him that love. And actually somebody else had already claimed him as an adoption. It was another veterinarian, actually.
Oh, nice.
But she couldn't take him for a while, so they're like, do you want him? And I was like, yeah, absolutely. And he came at a time right before life just got really difficult, and so he was that thing that kind of helped, keep me together. Cool. I don't know that there's necessarily, it has to be a certain way. It has to be right. I do believe that for some people, God brings them at a certain time. But I tell you, if you get that little bug, it's gonna worm its way in so quick.
Oh man, it was like this thing already. Like last night, it was in my daughter's bed.
Oh yeah.
Like, and it's completely bonded to my second daughter. Like, I mean, it like the first night he slept with the first night he like slept with me. Like he was on it, and I was like, what in the world? And he was out. Like just out.
Oh yeah.
And then the second night, like he was like in my daughter's bed. Like, and I couldn't believe it. I've never seen a puppy go the whole night without like going to the bathroom or something. but like he slept through the whole night. Like there's no.
I think the smaller breeds do have a little bit more of attachment, you know, kind of
to
people.
And that's the Velcro. So I'm a little bit like cautious of that because I'm like, whoa, hey, what's happening here? Like, but like I couldn't believe it, and so I'm wondering like maybe this is more my daughter's animal than it is mine, but like, but yeah, like. That little thing was like just nestled with her in her bed. Like,
Yep. And I think as long as like, you know, we approach kind of introducing a new animal in the correct way, we're not going to have a lot of the negative between pets, you know, kind of those kinds of things. But I think as long as you are ready to receive and love a pet, then it's always probably the right time, you know, to bring one in. But
that makes me feel better.
No.
You did it wrong.
No. There's,
because I'll be honest, like I feel like in some ways, you know, my daughters were even asking me like, well, how long are you going to be sad about Jake? And I said, well, probably a long time, honey. Yeah. Like I don't know that it's ever gonna fully go away. I think it'll get better. I think that it can get better. And you know, fair enough. Okay, he was a dog, but it's like I the biggest thing I did was I underestimated. You know, I took him for granted in some ways because I was so used to him just being there. And I felt, in all honesty, I feel terrible about how his last few months went. Now, to some degree, it's like I think I find myself questioning still because he walked to the van. It's like, well, you could still walk. Should I have? But the worst part was I wasn't planning on putting him down. Like I was taking him to the vet because I was like, okay, we need to get you pain shots for your hips.
Right.
Because he couldn't stand anymore for very long. He would start to I don't know what medically is happening, but like their hips start to like his back legs just started collapsing. I'm
sure he was having a level of arthritis and he was just having weakness from
arthritis. I don't know what was happening there, but like he could stand for maybe like a minute and then his hips would just start to collapse. And we got to the vets. I carried him inside because he can't really jump down from the car very well. So actually what happened was in the vehicle, he couldn't stand and he was on the floor crying. And he usually when we would go anywhere in the car, he would come up and he'd put his head on my shoulder and we would ride that way. But he couldn't do that because he couldn't stand. And like at that point I was like, oh man, like it's time.
It's time.
I knew, like I felt like I knew that it was time at that point. And it was awful. The other thing I wasn't prepared for was, you know, I guess it's a side effect with euthanasia that some dogs will howl. And like, oh man, talk about something that will rip your heart out. Like if you're not prepared for it, like I was like, oh goodness,
what is that?
So the biggest thing, and usually I will warn people, you know, of what can happen. You know, sometimes they just feel a little bit weird from the sedation. So what we're giving is an overdose of an anesthetic drug, and so they can feel weird as you're kind of, you know, going through that. Almost a little bit of a dysphoric phase that they can go through. They can take a breath afterwards. It's just reflexes of the body. So for me, I do try to prepare people because it can be unnerving when something like that happens. And we never know, you know, are they going to just drift off peacefully? That's what we hope happens. Are they going to take a breath? Are they going to cry out? And especially if they are older, more senile, they're more likely to kind of make noise or cry out like that.
That makes me feel better.
But honestly, like, just, you know, everything you've described, and for most people, I say you will know when that time is. You know, if you're still questioning, you're probably not there yet, you know, of knowing. But most pets will give us that look or that, and we just know. We know, or they can't even stand. They can't do normal functions, you know, and we just know, even though we're having to make that decision for them, we know it's time and we're doing this because we love you. You know, we're doing this for you. And it's hard. You know, it's not supposed to be easy because if it were easy, it means we didn't love them. You know, we didn't have that deep love for them.
Absolutely.
But hearing what you're saying, I think you made the right decision. You know, I think that, you know, you knew like it was time. And I think in his way, he was probably telling you, hey, I can't do these things, the things I love, you know.
Oh, thank you. It was definitely, and the weirdest thing too, I wouldn't have expected this to happen necessarily, but you know, I took him home and buried him. And so he was the first dog that the cats got introduced to, right? So on his grave, like for the next week, the cats would go over and like sit on it. Like,
On the grave?
yeah, on the grave. Like I'd never seen anything like it.
That's so
And then occasionally even Darla will go down and walk around it. I'm like, what in the world?
Yeah,
Like-
their senses are so much more advanced than ours.
Wow.
You know, so they can sense things or smell things or
Yeah.
just know that something, and even our behaviors can, you know, tell them, hey, something's wrong,
Yeah.
you know, or, you know, I'm sad and they're sad. You know, they
Yeah.
pick up on those types of things. So,
Yeah, it was wild. But yeah, I mean, because we brought, obviously, he was laying there, and we brought Darla over to say goodbye. And she did, you know, she was like, it was almost like she was kind of discovering what had happened. But that was really interesting.
yeah. And there are times where we have to euthanize a pet in the house, and afterwards, you know, the owners will bring that other pet in just to be able to see, okay,
Yeah.
they're gone,
Yeah.
you know, and versus hey, they left the house and they just never came back
Yeah.
home,
Yeah,
you know,
yeah.
kind of a situation. So,
Yeah.
And the pets can tell if the dog is gone.
yeah, I think they can.
Wow.
I think they can. I mean, pets are smart. Pets have even noticed things with their owners and found cancer in their owners
Yeah, I was gonna ask
before.
about
Yeah,
that.
so
I was gonna ask
before,
about
That
you
was the
know,
next place I was going
yeah.
to. So what is
Yeah.
that exactly? Just because
Yeah.
their olfactory system is so advanced, or what's?
Yeah, I think just their senses are so much more advanced and work together. They can just sense something's off, something's wrong.
Sure. Yeah.
And so they can sense kind of, okay, the owner's not quite right. They're acting differently, or they can smell something different. I mean, certain diseases we can put off, like certain smells and things. I mean, kidney disease, kidney failure, you know, there's a certain smell to it.
Yeah.
So they are so smart. They can sense things much earlier than we can.
Yeah. Wow.
Yeah.
That is fascinating.
Yep.
Yeah. I was seeing something somewhere like to where like I guess a pet's, and maybe this was like a long time ago on YouTube, like, but a dog's nose, generally speaking, is so sensitive that if you took an article of your clothing and put it in a stadium of people, it would be able to find you in that. Is that accurate?
Well, definitely
or
if
is
it's a
that, like-
bloodhound. I mean,
Okay,
they're
I wasn't sure
they're
how
like
much
the-
over embellishing. Like,
I think there's some dogs who, I mean, they can't even find the treat in front of them sometimes, you know. Like,
Yeah,
and there's some
very
there are some
good.
dogs who, they probably, especially if they are more focus driven, they could, or there's a super attachment there, they could. You know, there are some animals. We love them, but they're not the smartest in the world, you know. But honestly,
my
those
dog.
are the
That's my
happiest
dog.
ones, and I love those because
Yeah.
you're not so smart. You're outthinking me, you know, kind of a deal.
Yeah,
So,
right. Yes.
but yeah, I mean, they're just in general, and I find when we have older patients, they lose their hearing, they lose their vision, their smell is still there. Like they can still.
yeah.
They can't hear a thing, but they know when you're opening that treat
Yeah.
in the
the
kitchen, like two
Yeah,
rooms
1,000%,
away. They'll be there,
yeah.
you know. So
That's fascinating. I'm curious so one of the things that is kind of a debate in the, or we would call it, you could say it's a debate, but there's a lot of theories about how humans function in the therapy and psychology world as far as like, okay, nature versus nurture, right? And it was interesting. We had a guy on, Dr. Mike Skringa, and he talked about post-traumatic stress disorder.
Yep.
Right.
Yep.
Do you see that in pets? PTSD? Or do you feel that you see that?
I don't know that we can sometimes really officially know or label it as
Okay.
PTSD.
Gotcha.
I certainly think that there are situations where they associate a negative experience and trauma.
Sure.
And then they will be reactive to that. So if that's what you want to call kind of some sort
Yeah.
of PTSD, I think they do have that.
Some type of acute stress
Yes.
disorder that they have. in
I don't
response
think we
to a
have like
certain-
an official kind of term or condition for it. But yeah, anxiety. I mean, if I have a pet that comes in, something very traumatic happened, I mean, they will avoid that thing, or they will, you know,
Yeah.
react out of fear or anxiety to that thing.
Do you see that? Is that treatable?
I think it is treatable as long as we put effort into it.
Okay.
I think that medication and behavioral therapy definitely help with that. I do think that there are some dogs that we may never get 100%. And we have to kind of reset maybe our expectations at some point and say, we've had trauma, just like people have trauma and they can have triggers that come up just unexpectedly.
Sure.
We know that for dogs too. And just say, we start to know and kind of create a pattern as far as what their triggers are or could be. Mm-hmm. And we know that, hey, we're going to have to manage these situations when they come up. Mm-hmm. So.
What are some of those types of traumatic events for pets that you see them experience?
Oh, I mean, hit by car,
yeah, that's significant.
Yeah, significant death of an owner, just different things that change their world, or that they have been put through some degree of pain or recovery. Yeah. If they come in for a major surgery, and they associate coming into the hospital with pain, I mean, they're going to be nervous about coming in that next time sometimes. Yeah. Mm-hmm. So, it's just anything like that can create the same type of emotions we would experience if we had.
Do you see that some animals are more resilient than others?
Yeah, absolutely. Okay. Absolutely.
What do you think contributes to that? Is it some genetics and then some
I think it's probably some genetics, some environmental, I think that there are certain breeds that are just more resilient than others and certain breeds that are more nervous natured. Yeah. I certainly think
that's why I didn't ever want little dogs.
Yeah. Some things I mean, just like some diseases, there are some personalities that we can breed into them. And I think that's where if we're going to be in the breeding world, having good breeders who recognize there are certain qualities that we don't want, and we need to start filtering some of those out. Certainly, I think mixed breed dogs are great as far as they don't have a lot of the diseases.
Sure.
But you don't know what is in there. Yeah. And so we're starting to kind of see, okay, well, what personalities are starting to come out? I think some breeds, they're definitely resilient. They're forgiving. They are, they'll give you as many chances as you want or need. And I have some that are just so not trusting even from the start. And you just have to work really hard to gain their trust.
Wow. That's interesting. Mm-hmm. That's fascinating. Mm-hmm. Yeah, because it seems like, at least in our world, a lot of the current debate is around nature versus nurture. How much of, and I think it forever will be, because I don't know that you'll ever really have the answer. Right. Because I think there's really probably a lot of variables, and how can you truly know? Right. But yeah, it's nature versus nurture. Right. Okay, how much does environment, attachment, work into play towards what we're seeing as a behavior, and is it treatable? Right. Like, can we come to a place to where, okay, yeah, we can experience a significant level of decrease in intensity, frequency, and duration. And I guess that's been a curious question for me in regards to pets. Right. It's interesting because I remember our, Aussie Shepherd mix, Scarla. She went through a period to where she killed chickens. Yeah. Right. And I absolutely used corporal punishment. Now, funny enough though, like in defense of not utilizing corporal punishment, the thing that actually worked the most, I think, was exposure therapy. I brought her into the coop with the chickens, and she did not like that. Right. Like, she really didn't like it. It made her uncomfortable even. Yeah. And I would say that was the thing that started to really, like, you could see the turn of like, okay, well, I can't eat them. I can't kill them. So she stopped. Every once in a while she might chase them, but really we saw a significant decrease. I would say it was probably about 7 years ago now. Like, we wouldn't see her. She wouldn't kill anymore. Yeah.
So you just put her into the pen?
Or excuse me, it was 5 years ago.
Yeah. So you just put her in for like a few minutes?
Oh, no, it was like hours.
Oh, you just left her?
No, I was there with her initially, and we would repeat the process.
Yeah.
Oh, I see. And she got used to it.
And I think animals are like kids in that they kind of need those rules. They need the boundaries. We need to set those for them. When we are not setting appropriate boundaries for them and letting them know what we expect of them, I think that's where we can have a lot of behavioral problems. I do think kind of that nature versus nurture does play into animals as well. I think there are certain just breeds and personalities that we know this is a thing. This is a thing that we're going to have to kind of deal with. How big is that thing going to be? depends on what their home life is, depends on how they started life, what training they've had, you know, and just knowing this is your propensity, this is in your breed, you know, how do we change the environment to help you cope with those things?
Sure.
How do we train you, and you specifically too, because, you know, you have a standard of what may be in that breed as far as their temperament, but they're all individually, you know, a little bit different. But I do believe a lot in kind of what their environment is, what we expect of them, and do we communicate that as far as, you know, hey, I don't want you to chew up everything in sight. Well, do I leave everything out for you to chew up? You know, like, are we teaching them? Yeah. Are we teaching them what is acceptable, what's not acceptable?
Sure.
Very interesting.
No, that's fascinating. And I wonder, like, how, in terms of what you brought up initially, like, okay, like seeing a lot of anxious dogs, what do you think is the answer there, or what do you feel like is the thing that's going to help or remedy that scenario or that situation? Does it mean that owners need to perhaps practicing not unloading so much on their pets, or what does that mean? Is it
and I think we're still trying to figure out that answer.
Gotcha.
And I think the answer is different in each case. I think there are certain scenarios where, you know, we do need to be aware of that they feed off of us. And so if we're unloading one way and we're not, you know, kind of maintaining that balance with a relationship, we can create anxiety. If we're not socializing them, you know, but also if we're not recognizing they are animals, you know, and we need to work with their nature as well. I will say my dog did chase down a chicken, and I was so mad at him I didn't talk to him for a little while. That's probably not the best way to like approach it, you know, because he is still a dog. He does still have those tendencies. And instead of being emotionally upset over it, I just need to let him know these are the boundaries. Let's train you to not chase down the chicken. Okay. You know, so I guess there's not just a blanket kind of therapy or answer to it. I think it depends on each case. I think
very therapeutic answer.
I think that it depends, but also I think that owners can play a huge part in it. By, okay, we're doing medication, but medication's not enough. We do need to change some of the environment. We do need to sometimes just step up and take firmer control of them. Instead of, you know, just passively sitting back and just kind of saying, well, you know, they're going to figure it out on their own. They're going to, you know, they're not, you know, they do need some direction. And honestly, having more training, more behaviors, more things that we can send them to, because at the end of the day, as a general practitioner, I can't invest the time in kind of the behavioral stuff at home and training. I can give as much advice as I can. At the end of the day, I'm like, well, here's some medication, this will help, and here's what I recommend. And it's kind of, you know, on them to accept that responsibility of the pet owner and go forward with training.
What are the do you know what the certifying bodies are for the behavioral trainers, or is there like a certain certifying body of
they have their own kind of training that they can go through. You know, I do not know off the top of my head kind of how long that training exactly, if it's more just a certification kind of training versus an actual, like, you know, some can go further in degrees, things like that, and get more official kind of training. Some of it's just more certification training. You know, the place to start a lot of times is as puppies, and I did not do this. I had every intention of doing it, but work gets in the way a lot of times. Is starting when they're puppies, starting training when they're puppies. You know, we can avoid a lot of behavioral things, even if it's just obedience training. It doesn't have to be specialized training. And just the biggest thing is everybody in the house is on the same page as far as what the rules are. You know, it's very confusing for animals if, you know, mom lets me sneak a cookie, but dad's very strict about it, you know, kind of thing. So they just have to know.
Just like for kids.
I mean, so
and
they just have to know.
Too. They'll know who to go to. Right? Cool. So as we're coming to kind of wrapping up here, if you had any other questions. I have some hot take questions for you. So I'm gonna say the word, and I want you to, if you could just share like what your thoughts are on that.
Okay.
Pet insurance. What do you think about pet insurance?
Sorry.
This is great.
I think it's great when it works, you know.
Okay.
So I think there are certain pet insurance that have the same. If it's a pre-existing condition, they may not cover it.
Got you.
I have a lot of people asking me like my recommendations on pet insurance, and I'm like, I won't make a recommendation on anything because it doesn't affect how I do my job.
Your job. Yeah.
I think that some are better than others.
Yeah.
And if you have a breed that is prone to a lot of problems, I think insurance is a good idea, but make sure that they are not going to exclude some of those problems.
Okay.
Yeah.
So it depends on the breed. Okay. Grain-free diet or foods.
Oh, yeah, please.
Grains are not the problem.
Good to know.
So nutrition is a very kind of big topic. And I will say that most of the problems I have with foods, as far as like food allergies, are protein based. So it's going to be your protein, your chicken, your beef, things like that in it.
Like too much or too little?
No, just let's say that you're allergic to chicken. Doesn't matter how much chicken you eat, you're allergic to it. So they're actually allergic to the protein that's in there.
Oh.
Now, grains are not usually a problem, but they have become a problem when they started substituting in what we call these boutique kind of grains, things that dogs don't normally, eat. All your quinoa, all these different things.
Oh no!
And that now we're starting to see potential like heart disease, different things like that because we've changed the diet.
Trying to make bougie dog food.
Yeah, So we do see, and there was this run for a while where we were seeing, okay, is there a link between heart disease and some of these grain-free diets?
Wow.
So when I have someone come in and like they're on a grain-free diet, do they need to be on it? I was like, no, not necessarily. It's case dependent. If they have food allergies, most likely I'm going to put them on a different type of protein first.
Okay.
I think that you don't have to be on the best food out there, but let's not put you on the worst. Somewhere in the middle is probably fine for most pets.
Is meat still good as a first ingredient? Is that like, okay.
Yeah.
Yeah.
Okay. So it's not even like, so it's like, it's the type of grain that's
usually if we have problems, it's the type of grain that's in there.
Yeah. Gotcha.
Or the grain substitute or whatever they're putting in there.
Yeah. So what about like raw foods, raw diet?
I'm not a huge raw diet fan.
Yeah.
I think some people feed raw diet and their dogs do great. I have some people who feed their dogs Old Roy and their dogs do great. It's not necessarily the best food to be on.
Yeah.
I just prefer not to do raw diets because, you have potential for salmonella. You have potential for a lot of problems. Yeah. And I just don't know that I think it's necessary for most of my patients.
Gotcha.
Right.
That makes sense.
And what about, some people will get like the cooked, they'll cook their food or they'll get the fresh.
Like the farmer's dog.
Versus like, you see a lot of these ads.
I don't know.
Like Sunday and versus like just getting kibble.
I don't think that farmer's dog is necessarily bad.
Okay.
But I don't think you necessarily need to pay that much.
Right.
Yeah.
It's expensive.
It's expensive.
I think the big question for people is, because there's all those ads that try to tell you that, my dog would have lived to be 25 if I didn't just give him kibble.
I don't think that
doesn't appear to be supported.
I don't know that I can necessarily support the claims for that.
Okay.
For me, I look at each pet and say, are they eating it? Are they maintaining their weight? Is their hair coat good? Is their potting habits normal? Do they have energy?
Yeah.
That's probably an okay food.
Yeah.
If we're struggling with GI diseases, if we're struggling with certain kind of diseases, then I'm going to look at the food and say, can we do something more?
Yeah.
But I'd rather a client spend money on a middle of the road food and not spend so much that they can't afford it.
Yeah.
And bring them up to middle of the road if they're down here on a lower level food. Yeah. I don't think most of the foods out there, and I'm going to have probably a lot of emails from nutrition companies telling me, like, don't say that. I don't know that they have to be on a prepared food just for them. Right. Unless they are a breed that has specific problems and we're working with nutrition for a specific purpose, specific issue.
Yeah. Makes sense. Makes sense.
Absolutely.
Supplements?
I do like supplements. I think there are certain supplements that are worth it. Joint supplements, I think those are great, like Cosequin, Dasequin. Fish oil supplements, I think those are fantastic. If you are feeding a well-balanced dog food, you probably don't have to do vitamins or anything beyond that. And I think if you have a breed that is prone to having joint problems, even starting a joint supplement when they're young can help them later in life.
Cool. All right.
Yeah.
That's all. I mean, there's more, but
there's always. This has been fantastic. Thank you so much.
Yeah. No problem.
It's been a very good eye opener and one that we haven't had the conversation with yet, and so I'm really happy we did. And maybe there'll be one in the future, and we'll have to have another furry guest on or something like that.
Yeah, we'll bring our furry guest. Maybe Moose.
Maybe Moose. We'll see. We'll see.
All right. Oh yeah, thank you so much. That's really, really informative. Really helpful.
Yeah. Thank you for having me.
Thank you.
Awesome.